Uganda has a very poor rating on child immunization in Africa. The Uganda National Academy of Science says Uganda is at the very bottom of the list. Other research bodies paint a grimmer picture by ranking Uganda second after Somalia amongst the countries with the worst rates of immunization. This statistic is one of the reasons that prompted the Yumbe woman MP to come up with a bill on immunization.
There was an outbreak of polio again after 10 years being declared by World Health Organization that we are free from polio. And just last year, in the middle of the year, we had outbreak of the measles, where even my own child was affected.
From a country that used to have performance of over 90% to being only better than Somalia and having a coverage rate according to the Uganda Demographic Health Survey of 52%.
O'Hara and her other colleagues in Parliament are pushing for the approval of the draft to boost immunization in the country. The government currently has no specific policy on immunization.
We had, as members of Parliament, outreach to Mountain Elgon, but they have a category of people who believe that their children must not be immunized, and they said that is their religion.
An attempt to arrest some of the parents who refused to immunize their children was frustrated by the lack of legislation on this matter. But that may well change if the bill is passed into law, given that President Museveni proposed its introduction while launching the pneumococcal vaccine.
What would they say if we were to legislate to criminalize failure by parents to bring children for immunization?
If passed, the bill will be called the Immunization Act 2013. It seeks to make it compulsory for children under 5 years to be vaccinated against preventable diseases, including tuberculosis, measles, polio, tetanus, and others. The bill also targets women of reproductive age and other groups for vaccination. Women aged 18 to 49 must be fully immunized against tetanus. Medical practitioners are supposed to issue immunization cards to the parents after immunization, and only they can postpone the process on medical grounds. Parents are supposed to keep the cards for at least 10 years. This will come in handy, especially where the bill spells out that schools should only admit children who have been immunized after evidence is presented. This has, however, not gone down well with some people.
You cannot penalize somebody on an offense committed by another person. For example, if I'm a child, I'm not immunized. It is not my offense. Could have been the weakness of my parents. You cannot block me, cannot condemn me to permanent ignorance.
Penalties in Part 3 of the bill, if compulsory immunization is not adhered to, will see two offenders pay a fine not exceeding 500,000 shillings, about $200, or attract a jail term of not more than 6 months, or both. Some people argue that the likely offenders will be the most impoverished people. They instead advocate for community service.
Someone should be given a punishment to go and clean a toilet, a public toilet, come back home and feed his child. If the parent, for example, fails to pull a 500,000, he or she is imprisoned. What about this child we are talking about?
A law is meant to stop people from committing crime. It doesn't matter whether you are poor or not.
The Ministry of Health is also open to the penalties.
This one is supposed to compel those people who are spreading rumors against immunization.
But can the blame for these rumors be heaped on the lack of sensitization?
No, we have largely depended in the past. We have largely depended on educating the masses. But according to the Bible, St. Paul said, if the grace fails, you can employ some force.
But who gets punished when vaccines are not available in some districts? The bill does not have a clause on this, aside from ordering the state to ensure provision of free vaccines to all who need them.
We've had stockouts of essential vaccines for over 6 months.
So whom are we to blame? Are we going to blame the people that we're not educating them?
Well,
6 months, honestly.
Wouldn't, because procurement and distribution of vaccines is a responsibility of government. The responsibility is going to national medical stores.
Can I also assume that UNEP was somehow failing in the delivery system?
I wouldn't like to say it was failing, but somehow they were overwhelmed because the districts became too many and the budget remained limited.
The districts still have many challenges that have led to Uganda being one of the worst performers in immunization.
The topography of Kabong district. You know, Kabong district has a population of 357 people. The land area is wide. It is hilly. It's neighboring Sudan and Kenya. So our people, some of them stay up the hills. There is no vehicle that can climb up there. So to take a vaccine there, first of all, takes long. And the environment and so on affects it.
Germany, we need to carry out a number of outreaches so that our health workers can be able to move from the health unit and then go to where the people are.
Immunization for Kabale is reasonably good, but it is going to continue declining if we don't get other inputs like vaccines.
To solve some of these, the Sabin Vaccine Institute, whose main work is to develop vaccines and advocate for their accessibility, is seeking sustainable funding for immunization in Uganda.
It's not enough for us to depend on donors to fund one of the most cost-effective, preventable interventions in the health sector today.
But even with all these efforts, the advocates of the bill on immunization think that if a law is passed, it will serve as a wake-up call for lazy parents and caretakers. Florence Nalimba, NTV.